Hi everyone, in this lecture I am going to deal third stage of labor. So in our previous videos we already discussed about the first and second stage of labor, in which the first stage means the cervix is going to be dilated fully, and once it becomes fully dilatable, and in second stage the fetus is going to be expelled out, right? Now once the fetus is going to be expelled out, what coming next? The placenta and membrane need to be comes out. So the third stage of labor begins with the expulsion of fetus. It begins with the expulsion of fetus and it ends with the expulsion of placenta and its membrane. So third stage ends up with the expulsion of placenta and its membrane, right? So if we are not giving any intervention to a woman and we want that this placenta needs to come out naturally, so in this whole process it takes only 15 to 20 minutes to complete, right? But we want to give intervention and we want active management of this third stage, so it takes only 5 to 10 minutes to complete this whole process. So within this 5 to 10 minutes the placenta and the membranes going to be comes out, right? So the pressure within the uterine cavity remains same as in second stage of labor, because we have seen in first stage of labor there is a 40 to 50 mm of Hg pressure once the uterus become contract within this uterine cavity, right? Because there is only need for dilatation of the cervix, but here in the second and third stage the uterine contraction become more intense. So with this increasing intensity the pressure become also rises within this uterine cavity and it remain 100 to 120 mm of Hg in both the stages of labor. But still with the same intensity and with the same pressure inside the uterine cavity, the woman is not feeling pain, that much pain as she is having during second stage of labor. Why? Because during second stage there is the force because of the stretching effect of the cervix and the stretching effect of the peritoneum, because all this happens to expel the fetus to comes out, right? But here there is only the placenta or the afterbirth products, that is the placenta and the membrane, that need to come out. So there is not that much stretching that causes pain in women as intense as in second stage of labor, right? So right now we have seen that this third stage takes only 15 to 20 minutes in primi-gravid, that woman who is pregnant for the first time, as well as for the multi-para woman. And if we are doing active intervention, that takes only 5 to 10 minutes to complete, right? And this stage mainly belongs to the expulsion of placenta and its membrane. So here in this lecture we will discuss what is the plane of separation, from where this placenta is going to be separate from the decidual lining, and what all methods are there to separate this placenta, and how all things are there in which we can clinically monitor that placenta is going to be separate or not, right? Now let's see firstly what is the actual mechanism through which the placenta is going to be separate. The most important thing which play key factor to separate this placenta and to comes out is the uterine contraction and retractive ability of the muscle fiber, right? So in this whole third stage of labor there are the three events which are going to take place. First, the placenta is going to be separate, right? So I need to write it here. First is the separation. What all three key points are there? First is the separation of placenta, right? And once it becomes separated, what happens? Because we have seen the placenta is usually attached with the upper segment of the uterus. It is not attached with this lower segment, right? So placenta is going to be attached with this upper segment, and once it gets separated, it comes down. It is not like that once it's separated, it completely expel out through the introitus, right? So once it gets separated from the upper segment, it descends down. So what is the next key factor is after separation there is a descent, right? So once it gets separated, it descends down, and where it is descending from, detaching from the upper segment, it descends down in the flabby lower segment, right? So from upper to, it descends down in the lower segment. Now after the descent, what is happening? Finally there is an expulsion of placenta, right? So these are the three important events which is going to take place in this whole process: the separation, and then descent, and finally the expulsion. So how it is going to be separate? As I told you that there is one important phenomena, that is the uterine contraction and retraction. So with this strong retractive ability of the muscle fiber, retraction means that is the permanent shortening of the muscle fiber. We already discussed in the previous part. So once the muscle fiber become permanently shortened up, just see here what I am saying, that suppose here it is the upper segment, right? And this is the discoid shape of the placenta, which is attached with this upper segment like this. So in the placenta also we have seen that the diameter of this placenta is about 15 to 20 centimeter, right? So this whole 15 to 20 centimeter diameter of this placenta is occupying over the upper segment like this. Now once the uterus become contract and retract, it become progressively shorten up, right? So this whole surface area, as you can see in this image, the whole surface area of this placenta, which is going to be attached over the upper segment, it become reduced in size, because the uterine cavity, the size of this uterine cavity is become diminishing, right? So once this become contract or retract, this whole surface area is not keep pace with this diminishing surface area. So this placental attachment site, that is this implantation site of this placenta, get detaches, and once it get detaches, we can see the buckling of this placenta, that the placenta is going to be bent up in the uterine cavity, right? So why it is happening? Because we have seen once the fetus is going to be expelled out and the fetus is completely expelled out, the size of the uterine cavity just decreases suddenly. One important thing is that, and it only accommodate the after birth products only, that is it only accommodate, this whole cavity only accommodate the placenta and membrane only once the fetus expels out. So this placenta is attached with the decidua, the endometrium of the pregnant uterus, and it starts separating from this decidual lining. And what is the plane of separation? Very important. It starts separating from the spongy layer, right? It starts separating from the spongy layer of decidua. It is very important. So the placenta is going to be separate from this decidua spongiosum. So once it separate with this spongy layer, only thin layer of decidua is still remaining with this endometrium, because this layer need to be regenerated after the expulsion of this placenta, right? So it starts separating from the spongy layer of decidua. Okay. Now, so we have seen what all events are there. Once it's separated, it descends down, right? So from where it is going to be separate, it starts separating from the spongy layer of the decidua. So how we can clinically identify that placenta is not separated yet? There are few signs. What all signs are there before separation? Firstly, the shape of this placenta has become discoid, right? So once the fetus is expelled out, the height of the uterine, the height of the fundus become reduced, and it just come below the umbilicus. One important thing, the height of the fundal height just remain below the umbilicus. Very important, below the umbilicus. And the another thing, once it comes just below the umbilicus, the shape become discoid, because the placenta is discoid shape structure which is attached to the upper segment of the uterus, right? So once the height become reduced and it comes just below the umbilicus, the shape is of about discoid in nature, right? Now how you are going to be feel this fundus? It is firm in nature, because once you place your hand on the abdomen of a woman, you will feel the uterus is harder, right? Because still the uterus is contracting. So why you are feeling firm? Because uterus is contracting regularly. And the another feature is it is non-ballotable. So what is ballotment? That if you are placing both the hand over the abdomen of a woman, and if you are blowing toward one side, you will feel something with this another hand, right? So this is called ballotment. But here, as the placenta is not separated, so it is not moving inside this cavity, so you will not feel anything with this hand, right? So this is called non-ballotable uterus. So before separation, what all thing will can find out here is the uterus is the fundal height become discoid in shape, and once the fetus is expelled out, the height just goes slightly below the umbilicus, and once you feel the abdomen, it feel firm and it is non-ballotable, right? Now let's see what all methods are there for the separation. There are the basically two methods of separation. One is central method of separation, and this method is called as Schultze method. Schultze method of separation, right? This is the central method of separation. It means the placenta is going to be separate centrally, right? And the another method is the marginal, and the marginal method is also known as Mathews Duncan method. So what is central and marginal method of separation? I have told you that in central, what is happening? With this strong uterine contraction and the retraction, what is happening? This placenta is going to be buckled up in the uterine cavity, right? So it start getting detached from this spongy layer of the decidua, and it bends in the uterine cavity. So with this image you can see, once the because it is not keep pace with this shortened implantation site, and it bend in the uterine cavity, and once it bends, what is happening? The vessels which is lying in between this placenta and the implantation site, they become toned, right? And with this toned sinuses, the blood is start getting collecting within this space in between the placenta and the implantation site. So once the blood is collecting behind this placenta, because it is behind, so it is called the retroplacental hematoma. So with this pressure of the placenta as well as the blood within this space just help them with this uterine contraction and retraction to separate progressively, right? So with this progressive retraction, the placenta is going to be separate gradually. So this is called the central method of separation or the Schultze method, right? So if this method is there for the separation, the fetal membranes, because these are already with this strong uterine contraction and retractive ability of upper segment as well as with this that is dilating effect of the cervix previously, help these membranes to detach very easily, and they become more foldable in the uterine cavity. So that membrane also comes out with this weight of the placenta, right? So if the central method of separation is there, in this condition, the fetal surface is expelling out first, right? This is very important. Now, what is the marginal or the Mathews-Duncan method, in which we have seen that in the placental structure we have seen that at the center the placenta is more thick and in periphery it is thin, right? So with this progressive contraction and retractive ability of the muscle fiber, the margins get separated very easily with this progressive retractive ability, right? So there is a progressive separation from this decidual lining from the margin onwards, and once it gets separated from the margin, there is a gush of bleeding. We can easily see by the vaginal examination. So in the central there is no that much bleeding, but with this marginal separation there is gush of bleeding because it is going to be detached from margin. So bleeding is immediately comes out from this uterine cavity, right? So this could be sign, and we can identify whether it is central or marginal. So in this marginal separation, as the membranes, that is the edges of the placenta, that is the peripheral edges, become separated, with this progressive retractive ability of the placenta, the uterine muscle fiber, the placenta gets detached progressively, right? So this is called the marginal or Mathews-Duncan method. So we have seen the two type or methods of separation, central or marginal method of separation. Now how we have seen previously what all events are there. So once from where this placenta is going to be separate, it start separating from this spongy layer of the decidua, right? And what all modes of separation are there? The central and marginal method. Now once the placenta gets separated, what happens next? The placenta is going to be descend down in a lower flabby segment, right? Now how we can clinically identify that placenta is separated? So what all features are there? So there are the features of, first, the shape. The shape which is discoid before separation, it is going to be changed and it is globular, right? Now it is a globular, okay? Because the upper segment, which is broader at the time of before separation, now it is going to be changed to globular because it comes down and it is occupying in a lower segment, like. So with this globular shape, there is a suprapubic bulge. We can identify easily. So there is a suprapubic bulge because this placenta is occupying in a lower segment, and the height of the uterus is slightly increases. It goes slightly up from the umbilicus because the placenta is separated, it occupying the lower segment, and this contracted or retracted upper segment rests upon this placenta or the lower segment. So the height goes slightly above the umbilicus, right? And again it is firm because still uterus is contracting. So if you place your hand on abdomen, you will feel uterus harder. But important here is it is now ballotable because the placenta gets separated, and if you just blow this uterine cavity toward one side, with this another hand you can feel that mass, right? So now the uterus is going to be ballotable. So these are the signs through which you can identify that the placenta is detached, it is separated, and it descends down in the lower segment, right? So there are the globular shape, there is a suprapubic bulge, and the height of the uterus is slightly goes up from this umbilical region, and it is the uterus is ballotable. But these are not ensuring sign that the placenta is separated, but the most definitive sign through which you can 100% sure that the placenta is separated is the permanent lengthening of cord, right? There is a permanent lengthening of cord. So cord is going to be lengthened up. How it is lengthening? Because the length of the cord which is lying in the uterine cavity once the placenta is attached to the upper segment is now comes out because the placenta is low lying, because the placenta is in a lower segment. So the length of the cord which lie in the uterine cavity now comes out, right? So the cord length is longer. If you compare with the previously, the cord is going to be longer now, right? So these are the signs through which you can see that the placenta is now descend down, right? So the shape of the uterus is globular, there is a suprapubic bulge, the uterus is now ballotable, and there is a definitive sign of permanent lengthening of God. And also there is a gush of bleeding, right? Because this gush of bleeding could be seen in the marginal separation once the placenta is going to be separate completely. So there is a gush of bleeding, and in central it is not like that much of bleeding because the bleeding is just accumulating behind the placenta, right? Because it is bending. The placenta is bending, right? So blood is collecting behind this placenta. But in marginal there is a gush of bleeding. Once the placenta is going to separate, the bleeding immediately comes out, right? So that could be seen in a marginal separation. Now after all this sign, there is a more chance of blood loss in a woman after this stage, and that can lead into the postpartum hemorrhage when the blood loss exceeding more than 500 ml. So what all natural means are there to control this blood loss in a woman is that we have seen that there are the three type of muscle fibers, the longitudinal, intermediate and the circular one. So these intermediate muscle fibers helps in the hemostasis mechanism to control this blood loss. And how it is doing this hemostasis? Because with this retractive ability, as you can see in this image, the uterus, because in third stage also the uterus is contracting and retracting, right? So once the uterus become contract and retract, the muscle fibers become permanently shorten up, and the fibers which is lying in the intermediate lining, they become shorten up and they occlude the vessels which is going through this muscle fibers, right? So these intermediate muscle fibers become retract and they occlude the vessels which are passing through these fibers. With this occlusion, the blood loss is less, right? So with this natural process, the blood loss is limited in a woman after this third stage of labor, and it is about 100 to 250 ml of blood loss in each woman. So with this lecture, we have seen the third stage of labor in which the placenta and the membranes are going to be expelled out completely. And once what all events are there for the expulsion of this placenta is first the placenta is going to be separate, then it comes down, that is descending of the placenta, and finally it is expelled out. So once it becomes descend out, how it is expelling out? With this voluntary contraction, the expulsive force which is woman is applying, that is bearing down efforts, the woman is voluntarily controlling or contracting the abdominal muscle fiber to push down this product of conception, or by the manual procedure also we can expel out this placenta and the fetal membrane, right? And we have seen the various signs before separation, what all signs are there, and after separation, what all signs are there for the placental stage, and what all mode or method of separation are there, that is the central and marginal method. Thank you.